International Men's Health Week kicks off on Monday, raising awareness of issues men face across the world. Well, joining me live is Professor Hickie, psychiatrist, co-director of the Brain and Mind Centre and author of Mind in Your Mind. Professor, thank you so much for joining us. So when we hear the words mental health, how would you describe this?
Your mental health and well-being is what you need every day of your life to function, to be out there, to be physically healthy and engaged. Very important to say, very important for men to recognise that. Many women talk about it, but many men need to know about it.
And this week's Mental Health Week is for men, as you said, and it's focused on healthy habits. So how important is it for us all to have healthy habits?
Well, we think about this, Jane, in terms of our physical health, what we eat, our diet, our exercise, staying fit through what we do every day. For your mental health, physical activity every day, being out in the sunlight to set your body clock, being engaged in the world, looking what we do in terms of alcohol and drugs, but having regular daily habits so it doesn't become a burden, doesn't get you down, stuff you just build into your everyday life to be well, so you sleep well, so you can think well and behave well the next day.
And how concerned are you about the next year or so, perhaps with the rising cost of living, possible recession, and certainly on top of what we've had over the past few years?
We've had a tough few years. So COVID's been tough for people and very difficult, particularly for young people. Now we see considerable threats in terms of cost of living, rental and other pressures on families and others. And for a lot of men, that's going to be important. For a lot of families, that's important. So these are risky times in terms of mental health in developed economies and here in Australia for those who are doing it tough. So it's an important time we get things right on the economic front, on the social front, but also in providing mental health support and, where necessary, mental health treatments for those in need of care.
And Professor, is the Labor government doing anything this year on more access to psychological care, especially when it comes to children and young people?
Well, Minister Butler has made it clear that things were not done in the budget that we've just seen in May. There was an emphasis on primary care, general practice. But this year, the government has to fix up the Medicare access to psychological care. That's on the agenda for this year. So I think we all need to take a close interest in whether the minister goes ahead and actually does that. We need action this year to make sure services are there, and particularly for what you just emphasised, particularly for children and young people who did it tough during COVID, where we've never really had a service system that worked and who are in greatest need.
How long are wait lists for some people?
Some waiting lists don't exist at all. For many people who can't afford it, there is no waiting list. They can't get in because their public hospital or their public system isn't providing it. For those who are queuing up in the private sector, it's very common for people to say, look, not even this year, maybe next year I can see you. That's just not good enough. And we need to make it affordable. The minister has made a big fuss about equity and access and affordability, and that's right. So we've got to get more people who can't afford it all in, but we also have to make it more affordable for most people to get there. Clearly, we're going to need to do things differently and respond to those in greatest need first, and then look at other strategies, self-care strategies, online strategies, other ways of helping people who do not need as much clinical care as some people do, and particularly some children and young people who are in stacks of trouble.
And you mentioned online resources and also books. I know you are an author yourself, so yes. How important is that? We'll get the book on screen for you in a moment.
You're very kind. Well, we all need to know more. We need to know how to help ourselves. We need to know how to help each other. We need to learn more. And in early stages of many of these particular problems, we need to go online, or we need to get information. You need to read good books. You need to know how to help people in your own home, in your own family. But you also need to know when to go to care, what kind of clinical care would help. The more you know, the better care you'll get for yourself or your kids or those people you care about. So the more informed we all are, that really helps. We've got to look at doing things new ways. We can't just have waiting lists where people just never get to the front of the queue.
And we've spoken about this before, the good old-fashioned laugh, which, sometimes life can be serious, but I know with your podcast and so forth, it is really healthy for us to have a giggle or two, isn't it?
It is, and in tough times, it's important that we come together and support each other, do things together, laugh together, spend time together. It's not all about seeing a psychologist, it's not all about seeing a psychiatrist. A lot of it is helping ourselves and also making sure that we help each other with the real pressures that people are under. People are under real pressures, financially, under rental pressure, under home pressure. And if jobs get tough, if the economy takes a downturn, it becomes even more important that we do all we can to support each other in tough times. And for those who then really need help, making sure they can get the care they need.
Professor Ian Hickie, thank you so much for your time and expertise.
Thank you for the opportunity.